This program is brought to you by the Georgia Neurosurgical Institute. For over 50 years, rendering neurosurgical care to patients of all social conditions, treating complicated problems involving the brain, spine, spinal cord, and peripheral nerves, endeavoring to encourage quality care, medical research, innovation, and education on a local, national, and international basis.
Good evening. I'm Joe Sam Robinson, and it's my pleasure tonight to have my colleague and partner, Dr. Arthur Grigorian, with us. Welcome, Dr. Grigorian. Nice to have you here.
Thank you for inviting me over.
Well, now, Dr. Grigorian, your background is interesting. You've had quite an adventurous life. I think you grew up in a faraway place called Armenia. Where exactly is Armenia?
Well, I wish we had a little map here. I will probably explain it a little bit better. Armenia, it's quite a small country. It's a landlocked country which is located Trans-Caucasian area of Europe, right on the border between Europe and Asia.
Yes.
At some point, historically, this country was relatively big by those standards. But over the years, Armenia lost a lot of its territory and eventually lost its independence. Currently, this country has just about 11,500 square miles. The population of the country currently, I believe, in the range of about 3.5 million people. So that's where I was born and that's where I grew up. That's why I finished my medical school.
So you've had a lot of adventures in your life, and a little bit later we might show some pictures of Armenia, but maybe we can talk about a subject I know interests you greatly, as it would anyone, and that's yourself. Everybody's interested in themselves, and you've probably got some interesting stories about your adventures. I understand you were a tremendous athlete in your younger days. Is that correct?
Well, I know you were a pretty good athlete too. I don't think I was in comparison.
We'll make some jokes about that. But you were really a pretty good runner. And
well, remember, back in the old Soviet Union, and Armenia was a part of the Soviet Union, the extreme attention was paid to the physical well-being of the young generation.
Yes.
So yes, everybody was involved in some kind of sport activity. I was particularly in track and field.
Yes.
So I was running 100 and 200 meters, and I thought I was doing quite well.
Well, in our younger days, maybe we could have competed against one another, but that's another story. Well, you grew up in Yerevan. That's the capital city in Armenia, and I think your father was a mathematician. Am I right about that?
Yeah, my father still teaches. He's an engineer by profession. He's a mathematician. He teaches in polytechnical institutions in Armenia, in the capital. And my mother is a psychiatrist, and she's still practicing.
So pretty bright parents. And let's see. I think you took an examination. You grew up in the old Soviet Union, and there were examinations given for the brightest people to go to Moscow. Is that right? And what happened?
Well, yeah, the educational system was, I would say, probably quite complicated. You have to be on the top of your class to be chosen to accept it into sort of residency program, which United States has the same system.
Yes.
But only 3 to 5% of people were able to successfully pass the exam and be accepted in a high level of the residency. And the best places at the time were not abroad. The best places were either in Moscow or St. Petersburg. And I guess I was lucky enough, and maybe smart enough, I don't know.
Well, some of both possible.
To be accepted into I think the best neurosurgical training program, which was in Moscow. That's what I moved in 1987 and stayed there till 1991. Then I moved to the United States.
Now, you trained at the Bardinko, is that right? And so the way the Soviet medicine worked in those days, there were really complicated cases all went to the center. Is that correct? So you were getting a very taxing neurosurgical cases.
It is a gigantic institution till now. It has about 5 departments, only neurosurgery, nothing else. Right. And the people, they operate probably about 25, 35 surgeries per day. Enormous amount of experience. The young physician who just got there can, acquire. And that's what I guess I was lucky to work there for about 4 years.
Well, I'm sure you had a really fulsome experience.
I guess that's where we met first time with you.
Well, that's possible. Dr. Grigorian, we could discuss how you came from your interesting faraway background to this part of the world. But I guess we had you here many years ago as a neurosurgical fellow. Was that right?
That was my first experience with the Georgia Neurosurgical Institute. It was 1991, I believe, I spent about 6 months with the group.
Yes.
And I guess you guys like the whole scenario,
Yes.
and I like the group very much. So after I went back to my formal training, and at this time U.S. training in New Jersey, and then follow up in New York City, I liked that area and the place so much that I returned in
Well,
2000.
we're great to have you here, Dr. Grigorian, and we'll talk about some of the interesting talents and skills you brought to this part of the world. But let's see, possibly maybe you could show us a few slides of Armenia, if you're
Absolutely. And actually, one of the things that I want to say, after I left the country and completed my education in the States and finally got into this current work in the Georgia Neurosurgical Institute and became an associate professor in the Department of General Surgery at Mercer University, I tried to put something back to the medical school that I grew up and was trained. So we established, with your help, obviously, we established excellent connection between Armenian Medical School and National Institute of Health there, and Mercer University, Medical Center of Central Georgia, now institution. We have very good connections, and we have this exchange program. And I think you were the first visiting professors there.
Yes, it was.
It was about 5 years ago.
A number of years ago. That's right. That was. I didn't have my beard in those days. I
No,
think.
no.
I'm not sure how long my wife will allow me to keep it as it is.
But I think this connections between Central Georgia and the Medical Center and the Mercer and Medical School back in Armenia is extremely strong now. Had a couple specialists from the local community here traveling to Armenia and helping us with establish neurology surgeon, Dr. Charles Wells.
Yes, yes.
He's a sleep neurologist here in Macon who spent his time and I think had a tremendous success of giving a series of lectures in Armenia. And after that, I'm traveling now every 3 to 4 months because they opened vascular center, and we'll talk about that later on,
yes,
I guess,
right,
what vascular surgery is about. And last time we went there was me, Dr. Olm, who's currently associate professor of neurosurgery in LSU, and 2 nurses, who absolutely 2 wonderful individuals, Sheila and Donna Monroe, who devoted their time, their professional knowledge to train young nurses there in Armenia, and they did absolutely great. So that connection still exists.
Well, and am I correct that you may have some slides to show us?
Absolutely. I think the interesting slide, do we have the
You
slides?
have some slides here? Oh,
Okay, this is the mountain Ararat, which is currently located geographically on Turkey, but absolutely wonderful view from Armenia. And historically, you know what Mount Ararat?
Well, I believe it had a little connection with the Ark, did it not?
That's correct. That's what we all believe. And
If people tried to climb to the top of the mountain to search the allegedly Noah's Ark, by maybe it's apocryphal, but allegedly that's where Noah's Ark landed. Is that right? On
yes,
the top?
this is the common belief is that the Noah's Ark is still located on the top of the Mount Ararat, but as much as I know, nobody was able to find actual real.
But people have had expeditions to search for it there.
Yes,
That's a common
as a matter of
story.
fact, actually, me and you were planning to climb Mount Ararat at some point.
Well, it's certainly, I'm ready for it. It's really quite a beautiful mountain. And this overlooks the capital city of Armenia, Yerevan. You see this mountain, and it has a hypnotic impact on one's imagination, does it not? Just to see the mountain. And it's unfortunately for Armenia in another country right now. And so, is that right?
That's correct. I mean,
a very strong spiritual bond between the Armenian people and this mountain. Is that
very
correct?
strong spiritual bond. Particularly, Armenia lost a lot of territory, and a lot of bad things happened historically. The worst thing happened in 1915 when approximately 1.5 million Armenians were massacred during the last days of the First World War. And actually, my grandfather was born in Turkey and Trabzon, and most of his family was unfortunately died during that. And he moved across the Black Sea towards the modern Russia, or at that time Soviet Union.
Yes, yes. And so one of the things about the Armenian people is they've gone all over the world. There are Armenian people everywhere, and they've sort of had such a difficult time from a geopolitical point of view that they've established communities in many different countries and made substantial contributions.
Yeah, and that's happened after 1915. I think the largest communities is in the Middle East. Another one is Russia, and then France and the continental United States, particularly Northeast and California. One of the interesting things is that Armenia, and probably not too many people know that, is the oldest country in the world that accepts Christianity as a government religion. It's 301.
Wow. And if my memory serves me correctly, St. Augustine the cross did not appear in the sky to him until 312. Is that right? So
that's correct.
And it did not become the sort of state religion of the Roman Empire for at least 325.
That's
so
correct.
Right.
Yes. So Armenia actually had its Christianity accepted in 301. And till now, you can find absolutely beautiful, amazing churches there. And I think
are you going to show us some? Maybe you have some slides. Well,
this is one of the oldest churches and located in the mountain part of Armenia. And I believe it dated to about the 7th or 8th century. And if you walk in this territory there, and I think we hiked
with you it was a very enjoyable experience, I must say. A very, very beautiful country and full of great vistas and valleys and nice people.
Yeah, you have countless churches. Some of them are even quite bad condition now, but some of them are renovated. Like I believe this one was renovated after the earthquake. And this is Dr. Robinson.
I was much younger then. I guess that was before my beard appeared. And so let's see. Can you discuss there's obviously a priest next to us. The Armenian Church, they had a big celebration, did they not, fairly recently?
Yeah, Armenian Church celebrated its 1700 years, as I said, 301, so it was 2001. And on this pictures you can see it's a typical Armenian priest, probably low-rank Armenian priest that was working in that local church. And the Armenian Church belongs to the Orthodox churches, particularly known in the eastern part of Europe.
Yes.
But it's completely independent church, does not belong under the Russian Orthodox Church or Greek Orthodox Church. It's a separate church with the head of the church and the name of Catholicos, who is located in another little town not far away from the capital.
Yes. And I understand I was recently in Jerusalem, very interesting experience, but the Christian part of Jerusalem, there's an Armenian part there, is there not?
Yeah, this is one of the historical interesting facts about Armenia, and the Middle East. The whole Middle East is such a complicated area of the world. But yeah, the old city in Jerusalem divided on 4 quarters, and one of those quarters are Armenian quarter, and that's maintained all those traditions that for almost 2,000 years now.
Wow. Well, that's a very interesting story, and I think you have another slide, do you, Dr. Grigorian? One more slide?
Are you sure you want to see this?
I think so. This is many years ago, several years in any event. And can you describe
this is the picture I think we took with you on your trip to Armenia, which was about 5-6 years ago. And that picture is actually T-34, I believe.
Yes.
I'm not so much familiar with military hardware, but I think this is T-34. It's one of the most popular tanks during the Second World War. And here you're trying to push it back.
Well, I have sort of how can I say this? At least it's an amusing picture. It's actually, Armenia was part of the Soviet Union, and they repulsed the Nazis, and these tanks played an enormous role in that, and the Soviet Union produced thousands of them, arguably the best tank in World War II, or one of the best, a tremendous technological marvel, and there's such a tank right now in Yerevan.
So you think it's pretty symbolic, the American with the bare hands trying to push down?
Well, there could be a slight, something slightly, what can I say there, symbolic, but I hope we're all friends all over the world.
Absolutely.
And that would be a good thing. So we united in crushing a very bad situation. So good for us. We were all on the same team. Well, now, Dr. Grigorian, let's see. You've come here. You've been here a number of years. And you've got a very beautiful wife, I must say, and maybe you'd like to tell us a little bit about your family.
Well, absolutely. I think I'm blessed with having absolutely wonderful family. My wife is from Poland, and I have 4 wonderful children.
And you have to tell us their names. What are their names?
Margaret is my wife's name.
That's the beautiful wife.
That's right. Let's see if I remember everybody's names correctly. The oldest.
It's important. Don't get excited and not remember their names. Okay.
Caroline, she's currently as first-year student in the Georgia Tech. Very smart girl.
Well, that's a tough school.
It is a tough
What is
school.
she studying there?
Well, she started with biochemical engineering. I believe now she switched to chemical engineering, and I hope she will stay with the engineering because she's a very smart girl, particularly
Yes.
in the mathematics and chemistry and
Yes.
physics. So, no, we're very happy that she's there.
Yes?
Then I have a 11 years old. Her name is Sabina, and she's just a regular girl who
Yes.
studies hard, and she plays tennis hard. This is one of her passions, and she practices a lot, and we love to watch her play tennis. And
Yes.
actually,
Yes.
that's the 11.
And she's quite good, is she not?
Well, it's all relevant.
Yes.
Yeah, she's pretty good, I
Yes.
think.
Okay.
So
All right. All
I
right.
think we should ask her. if you
Okay.
think
You can
she's
maybe
good.
we can do that. And you
And
have
then we
some-
got two more. We have 7-year-old girl, Anna, and 5-year-old boy, Alexander. And
Yes.
one is in kindergarten in St. Joseph, and the girl is in 2nd grade in St. Joseph's
Yes.
School in Macon.
Well, good. So that's a really nice family situation. That's great that you've made this journey from Armenia to the heartland of Georgia. We're glad to have you here. Now, Arthur, in your experiences and studies, you've really developed an interest in cerebral vascular difficulties. We might discuss that a little bit about subarachnoid hemorrhage and what to do about that. And this is something that we see in our practice and people come to us from many different places. And maybe I'll just describe a patient to you, and you can just discuss maybe a little bit just for our audience tonight about subarachnoid hemorrhages, what one would do about this. And this is something I think it's a useful thing for our audience to be aware of. If there are people that read the Bible out there, and I think there's some, that in 2 Kings there's a description about a young man who grabbed his head. He had a sudden catastrophic headache, and then he collapsed at in the knees of his father, and then died soon after that. This can be a very dangerous set of events. And yeah, I think the normal presentation of this is a tremendously severe headache. It's different than a normal headache. And maybe you could what should you know, people have headaches all the time. This is a particular kind of headache that could be life-threatening. What would you be on the lookout for?
Well, I mean, in general, yes. This is a classical presentation of acute subarachnoid hemorrhage by the medical school standards even. It's an acute onset of extremely severe headache. Now, once again, we have to classify it as a severe, very unusual type of headaches that never experienced by the patient before.
Yes.
And obviously, that's an indication of some kind of event occurs in intracranial, which means inside somebody's head. And difficult to say what happened in the Bible in this particular episodes. And then usually there's two presentations with this kind of onset. It could be an ischemic stroke, which means there's an insufficient amount of blood supply goes to the brain, or it could be something we call hemorrhagic stroke, which is the actual bleeding in the brain. And you know, in the past, neurosurgeons were usually mostly dealing with the second scenario when we have a hemorrhage or bleeding in the brain. And if the source of the bleeding is something so-called aneurysm, which is a little blister on the blood vessel, then the neurosurgeons will usually get involved.
Yes. So what we have now, I mean, we've on our show here, we've talked a lot about the importance of emergency care and getting people where they need to be on an acute basis and not to hesitate. So I think if a person is suddenly stricken with the worst headache of their life, they fall to their knees, they vomit, it's something like being struck down is a real way to describe it. They need to seek medical attention very quickly. And a person presenting like this, what kind of symptoms would one expect after a subarachnoid hemorrhage? They come to the emergency room. What are we going to see when they arrive there?
Well, once again, it's all depend on the severity of the situation, the severity of the hemorrhage or severity of an ischemic stroke. Usually, those patients obviously needs to be hospitalized as soon as possible because unfortunately, the mortality is quite high immediately after that event. Now, in this region of the Middle Georgia, Medical Center of Central Georgia is qualified as a stroke center, which means an acute stroke, and it could be bleeding in the brain or insufficient blood supply, preferably need to be somehow get an attention of a neurologist or the vascular surgeon for the appropriate actions taken, because often this is something needs to be done very quickly on an urgent basis.
Yes.
And it's probably even more urgent sometimes than a heart event, cardiac attack.
And so lots of things can happen when this occurs. There can be some cardiac symptoms that occur. There can be, it's a really catastrophic event. And there are different grades of subarachnoid hemorrhages, different scales of that. I mean, how do we scale these things?
Yeah, it's all, there's a different classification that utilized in Europe, the European Association of Neurosurgeons using one grade. In Northern America, we're using something called Handheld classification, which is based, it's quite simple classification based on the multiple clinical symptoms, and it goes grade 1, or actually grade 0, to grade 5, which is quite terrible condition.
Yes, yes.
Right.
And when the patient arrives and you see the patient, what sort of tests are you going to get as the patient is seen in the emergency room? What would you do to look into this problem?
Well, first of all, it's an immediate involvement of emergency room physician who should be able to diagnose and hemorrhagic stroke or bleeding in the brain versus ischemic. So the first test, an easy performed test, it's a CT of the brain. CT currently those days are quite good in the sensitivity of detecting any even minor amount of the hemorrhage or ischemic changes. So the first thing that patient in this situation needs is an emergency CAT scan of the brain. Based on the result of that, an appropriate consultation will be sought by the emergency room
and so what happens, this is a rather complicated story about the emergency healthcare network in Georgia, but if the patient is seen in a hospital elsewhere, the patient needs to get to a facility where this can be treated. Is that right? And how would that happen? And does diversion ever occur? We've discussed that before on our show about diversion, about hospitals not being able to take patients. Is that a problem? Or what exactly occurs were this to happen, shall we say, in Hawkinsville?
Well, absolutely. Patients who do have the hemorrhage in the brain or ischemic stroke do require tertiary care. And Medical Center of Central Georgia is one of those centers that patients need to be transferred from, no matter where this event occur. And yes, it becomes a big issue and problems that often a hospital is just overwhelmed with the amount of the patients in emergency room, and unfortunately, for one reason or another, unable to accept the patients that are actually in a direct need of a high-level professional.
And so one of the things that we can do with the American healthcare system is find a way to transport patients where they need to go in an expeditious fashion, and hopefully that's something that our country will work out as time goes by. Well, and this is a rather dangerous set of circumstances, is it not? Once this happens, there's an extremely high mortality rate. I mean, a very large percentage of people die or are left with permanent neurological impairment once this occurs. Is that correct?
Well, statistically, we know that probably roughly about 50% of patients, unfortunately, would die before even get to emergency room.
So that's a big story, isn't it? It's a 50% death rate with this kind of problem.
Yes.
That's a pretty high death rate, isn't it? So if this event occurs, it's really it requires mandatory quick treatment. So are there some medicine we're going to give the patient, or what can we do as we assess the patient? And what would you do if the patient is here? We're thinking about what to do about it.
Well, first of all, when the patient is just arriving to emergency room, we have good trained professionals in emergency room, that ER doctors who are usually, or most of them, are able to perform all necessary steps to stabilize the patient's condition before they actually turn the patient to a neurosurgeon or neurologist. And that does involve stabilization of the heart function, lung function, vital signs, so on, evaluate the patient, perform CT of the brain, CAT scan of the brain, and then move appropriately. So the vital signs stabilization, initially when the patient just arrives to emergency room, is the most crucial aspect of the care.
And we'd like to get the patient in an intensive care environment. Is that correct? So this is the sort of patient that needs to go to a neurointensive care unit. Is that correct?
Absolutely.
And what exactly is a neurointensive care unit?
Well, neurointensive care is highly specialized unit. It could be neurosurgical, it could be surgical unit, where it's usually one nurse per patient or one nurse per 2 patients, and has all capabilities to maintain vital function of the patients, including observation, IV injections, respirator if needed. So this is highest level of care that is hospital is capable to provide to the patient.
And we're going to have another show to discuss some of the different kinds of things that you can do for these patients. But in regards to medical treatment, what are some of the things we try and do for these patients? I mean, we worry about seizures, we worry about...
well, obviously, there's a lot of factors that will affect the patient's condition and patient outcome after they have an ischemic or hemorrhagic stroke. Controlling the blood pressure is one of them, and potentially preventing the second hemorrhage or second bleeding, or preventing repeat ischemic stroke with medical medications, let's say. So all those major parts of the care are extremely important, because they will eventually direct the patients towards the recovery, hopefully.
Yes. And so one of the things is the timing to do something. I know that in the neurosurgical literature, there's been a big debate about when one intervenes, when one doesn't intervene. And are there circumstances when the patient presents that the situation is so bad that you would not recommend treatment? I mean, we often have that issue, do we not, with some of our patients? Are there times that the patient is, in regards to his examination, that there may be such an enormous brain damage already that we might not choose to offer the family anything or any?
Well, I mean, I guess it depends on a lot of factors. I myself consider me pretty aggressive. I don't give up easy. So if there's something I can believe still can be accomplished, I would rather wait than and give chance for something to improve or develop potentially. So for me, the idea of sort of hopeless situation is not often arise.
Yes, but it does. It does on occasion. And really, one of the things that we try and do as neurosurgeons is communicate prognosis to families. Sometimes there's a bad prognosis that there's an argument not to be aggressive. But if there's any chance at all, we generally offer, we let the family know about what can be accomplished. And if we do suggest something be done, do you have any comments about timing on this?
Well, in general, you want to know what you're dealing with, first of all. So once again, after the patient comes to emergency room and receiving all this supportive measurement and getting his CAT scan and having a diagnosis established, the next question comes, if there's a hemorrhage, where the hemorrhage occur? Does the hemorrhage occur from the aneurysm? Is it something else like arteriovenous malformation? Or is it an ischemic stroke? So usually one of the standard of care is performing either arteriogram or some other modalities which call CTA, which is a CAT scan with arteriogram, just to evaluate the vessels, to understand where the hemorrhage occur and how to treat it.
And that's a rather complicated intellectual decision to make. I mean, the vagaries of this are enormous, are they not? There are lots of things that one has to think about, and the quality of the x-rays are really important, are they not?
Well, the quality of the x-rays and studies in general improved dramatically over the last 10 or 15 years, enormously. And particularly, the good thing is that the Medical Center of Central Georgia currently, we have something called hybrid operating room, which has a top-of-the-line angiographical suite that allowed us to study vessels of the brain with great details, and usually can be done and accomplished on very quick base.
Yes. And actually, I think we're going to, next week, discuss a little bit more about this, about how to appropriately treat patients that have had this terrible problem. We are not always successful. Many complications, many difficulties occur. And it's not uncommon at all for us to see this kind of patient. I mean, how many patients do you think you see a year with this problem?
Well, I think by my last calculation, roughly, I probably deal with about 100, 120 patients with acute hemorrhages.
Well,
from the aneurysm we're talking about. If you add something else, it will make this number much, much bigger.
So thank you so much, Dr. Grigorian, and we look forward to discussing some treatments for this problem next week. Thank you.
Thank you. Thank you.
This program is brought to you by the Georgia Neurosurgical Institute. For over 50 years, rendering neurosurgical care to patients of all social conditions, treating complicated problems involving the brain, spine, spinal cord, and peripheral nerves, endeavoring to encourage quality care, medical research, innovation, and education on a local, national, and international basis.